Angelica
Hello and welcome to the 65th episode of Spurbs Herbs. Today we are doing a major herb. This is what I'd call definitely an A-lister. As I say at the summary of this, this is, if not top 10 herb, if not a top 5 herb, it's easily a top 10 herb. This is absolutely one of the most commonly used herbs that we use in Chinese medicine. It's lIng, or Poria cocos, just standard known as Poria. So let's get into it. Today, as I just mentioned, we will be exploring one of the most commonly used Chinese herbs, though for most people outside of Chinese medicine it is virtually unknown. In fact, I found no Western medical uses for this herb at all. It is strictly a Chinese medical herb, and it is lIng or Poria, and that's those both have the second toe mark, so lIng. So there you go. And this is a very commonly used herb in Chinese medicine for promoting urination and draining dampness. Basically, it's often considered an herbal diuretic. Plus, it also helps digestion and quiets the heart and calms the spirit. And as usual, we will be exploring something a little different. We continue our discussion of the Chinese pulse and add 2 more pulse types to our repertoire. So we're rapidly building our repertoire of Chinese pulses. Today we're not going to go as deep as I would probably like to, because we got a lot to talk about with lIng, but at least we're introducing them. So there you go. So please join us for this foundational and critical episode. And before we get into that, I just want to remind you all, we have started a new webinar series, and I wanted to let you, my podcast listeners, know about it before we got too far into it. It is integrative nutrition, and will cover biomedical and Chinese concepts of nutrition and explore the complementary and alternative concepts that are part of the modern supplement industry. This series will be 1 live class per month covering a category of nutrition, and will include some basic biochemistry, nutrition, and supplements available on the market. We've done a couple of them already. They've gone well, but I've learned from them. Like, I'm going to be adding a lot more Chinese medicine into these as we move forward, and a lot more about the nutritional aspects of this. I could probably emphasize a little bit too much the biochemistry and the supplements. The supplements are still super important, so we're going to get into those. But I'm refining as we go along. It's going really well. Want you guys to join us. It's, this is going to be the perfect combination of biochemical nutrition, supplements, Chinese medicine, and real-world use cases. If you're a practitioner of any stripe or just interested in nutrition, this is the series for you. And you can sign up for the first class or the whole series at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. I will only be teaching each class live one time. After that, it will only be available as a recording. And I'm going to give you a little secret here. I'm not super happy with the first 2, how they turned out, so I'm probably going to redo those 2. But then after that, it's just going to be one time and that's it. So don't miss this opportunity to learn about a topic all our patients ask about and get a firm understanding of the basics of integrative nutrition. And with that, let's get into our little something different today. As you know, we said we're going to talk about pulse diagnosis, and we started this 2 episodes ago. We started discussing the Chinese medical pulse, examining how to take it, what it can tell us, and how complicated it can be to take and interpret. In the last episode, we looked at 6 of the most basic pulse qualities. These are the first ones we've talked about. We kind of talked about how to do it in the big scheme of things, and then we got into these 6 pulse qualities: slow, fast, empty, full. These are pairs, so slow and fast, empty, full, and floating and deep. And they're pairs of opposites, obviously. Today, we're going to introduce 2 of the most important and commonly felt pulses: slippery and wiry. So the slippery pulse, also known as the rolling pulse, the slippery or hua pulse, is quite common in the developed nations. We would say because of our diet and potentially our exercise habits. According to Maciocia, a slippery pulse feels smooth, rounded, slippery to the touch as if it were oily, and it slides under the fingers. Traditionally, it is said to feel like a string of pearls being pulled under the pulse taker's fingers. It can indicate phlegm, dampness, retention of food, and pregnancy. Generally speaking, the slippery pulse is full by definition. This is again a quote from Maciocia. So generally speaking, the slippery pulse is full by definition, but in some cases it can also be weak, indicating phlegm or dampness with a background of qi deficiency. So that's what happens, when the spleen qi is deficient, especially the spleen, is in Chinese medicine is the main digestive organ. And that may sound a little bit strange to people who are Western trained, but when you actually look at, how they describe the spleen, they talk about the tail of the spleen. If you look at a spleen, it's like an oddly shaped balloon. There's no tail to it at all. And so, but right underneath is the triangular shaped pancreas, which is crucial for digestion. So when we say spleen in Chinese medicine, I am positive we're talking about a combination of the spleen and pancreas. And so when the spleen is not doing its job well, digestion doesn't do well, and we form dampness. So that's what happens here. So with that, so that's that weak slippery pulse with dampness of background or qi deficiency. Now, when I chart this, I don't ever, because I learned that the slippery pulse is a full pulse. I would never chart a weak or vacuous slippery pulse. What I will say is slippery-like, to kind of get around this sort of prohibition that I was given early in my career. So whether that's valid or not, but that's how I distinguish. So this slippery pulse is common because our diet, with its refined nature and emphasis on the sweet taste, tends to hurt the spleen and cause dampness and phlegm. Notice it can be considered a perfectly normal pulse in the context of pregnancy. In fact, I was taught you could tell the sex of the baby by determining which hand is most slippery. Left indicates male and right indicates female. And I gotta tell you, I've done this dozens of times. I would say the vast majority of them, I have not heard back. It was like I saw them and I said, hey, do you want to know? And it's just like a little fun. And I didn't get the report back. But in those cases I got the report back, which is probably about 10 or a dozen cases at this point, I was 100% correct. Never been wrong in determining the sex of the baby. So really interesting to do that. So there you go. Just a little interesting tidbit. All right, so that's the slippery pulse. Let's get into the wiry pulse briefly. The wiry or xian pulse, also known as stringy or bowstring or string-like pulse, feels taut like a guitar string. It is thinner, more taut, and harder than the tight pulse, which we haven't discussed, but we will. The wiry pulse really hits the fingers. Now, that all was a quote from Maciocia. One of my mentors said it should hit all three pulse-taking fingers at the same time. So what he said, and this is someone who's quite well known, at least locally, for teaching pulse and from China, very, very, very good at this. And he said, if you don't feel in all three fingers at the same time, remember we're taking the pulse with three of our fingers. If you're not feeling it hit all three at the same time, it's not a wiry pulse. Now that takes in, we get these rules in our head, but in reality, there's a little leeway there. So sometimes that third pulse was an interesting pulse. By the way, I got on the chat that someone who has a specialty of pregnancy for over 15 years says that pulse taking is absolutely true. So yes, thank you very much, Erica, for mentioning that. I appreciate that a lot. So that's been my experience. So anyways, okay, so back to that, the three fingers, the wiry pulse hitting the three fingers at the same time. Sometimes a pulse is short where you don't feel the third position very well. And sometimes people, who are a little bit larger, it may be more difficult to feel that third pulse because it's deeper and there's more fat there. So you don't always feel it hit all three fingers at the same time, but you should feel something, it should be close to that. And it can indicate several conditions, including and probably primarily liver disharmony. And by disharmony, we can mean a few things. Liver qi stagnation is probably the most common sort of thing that we see. Pain is another one too that can cause a wiry pulse, and phlegm as well. Though I got to say I see that, but probably less often than the other two. And you can see with just liver disharmony is just so common in our society, because our society generally, I want to say it's a stressful society, but it isn't. I think, in developed countries, we live a stressed lifestyle. Like, we're always going for the promotion and we're working hard and all that sort of stuff. And I don't want to discount like undeveloped countries and say, well, they have a totally stress-free. No, they have their own stressors. But it seems like the stressors in developed countries are a little bit more chronic, where they might be a little bit more acute peaks sometimes in others. And I'm painting with a super huge brush, so please excuse me for doing that here. But it does seem that the wiry pulse seems to be more common in developed nations, from what I hear. Not that I've done a lot of work in developing nations. So, and of course, pain is very common. So we feel that a lot. So this is a very common pulse as well. That's it. Excuse me. That is what we have for today. We have for just a brief introduction of the pulse, a little extension of the pulses, because we have a lot to go on. So we have a lot to cover with our important herbs. So let's get going in that. And there we go. So herb today, as we've been talking about, is lIng, Poria. And this is in the Polyporaceae family. The species we're specifically talking about here is Poria cocos, and it has those biologists in parentheses. It has SCHW. Again, you can look up these abbreviations of the biologist. That was the primary biologist, and then where it's actually done is where it is currently classified was by Wolf. So those are the two biologists involved with this. The medicinal part is very interesting. This is called the scleratorium, or sclerotium, I think would be how to pronounce that. And that's in a fungus. So this is a fungus. So let's just get that right out there. It's a fungus. It grows around tree branches. And what is scleratorium is sclerotium. Maybe I learned a scleratorium originally, and it may have been wrong. Sclerotium is a persistent vegetative resting spore of certain fungi. So this is basically a fungi, part of the fungus. And you're going to see that we kind of use the entire part of the fungus in this thing. But it's sclerotium is what it is. And sometimes you'll see Poriococcus sclerotium, which means the part of it. The English translation for lIng was not noted in any of the books that I looked at, and so I think it may be a specific species. Sometimes they'll do that with specific species. That's just a species name, like Poriococcus, so it's lIng. So other names for this include Hoelen, Hoelen, Tuckahoe, China root, Indian bread. But this is not the same as that used by Native Americans. So I think it's similar to Native American Indian bread, at least in looks, but it's a totally different species and is not used. This is an Asian herb. A different name for the species is Poria cocos. So it's an interesting name because it has the Poria, but it has the Poria. And remember, Wolf was one of the biologists on this, so I don't know where that is. Futu is a Chinese name for this, meaning crouching rabbit. And then other Chinese names include Songling, Songmu Shu, Yunling. We're going to talk about Yunling. That basically means fooling from the Yunnan province. It could also be called Polyporus. Matsuhodo. It sounds Japanese to me, but it was just on a list of names for this herb, so I'm not sure if it is. But in Japanese, it's called again, I don't know how to pronounce Japanese or Korean, but Bukuryo, Bukuryo, and in Korean it's Bakryong, Bakryong. So those are all the names for Fuling. Let's talk about the Polyporaceae family just briefly here. The Polyporaceae are a family of poroid fungi, a group of fungi that form large fruiting bodies with pores or tubes on the underside. They're also called bracket fungi or shelf fungi, and often produce woody, shelf, or bracket-shaped, or less commonly circular fruiting bodies that are called conchs. Most members of this family have their hymenium, the fertile layer, and vertical pores on the underside of the caps, but some of them have gills or gill-like structures. Many species are brackets, but others have a definite stipe or stem. A stipe is a stem, a fungal stem. Most of these fungi have white spore powder. So that's just a brief introduction to this family of fungi. I think it's one of the first fungi we've talked about in Spurbsers. You know, fungus and mushrooms are very, very common in Chinese medicine and actually are super useful. And we're going to find out this is super useful. All right, so let's talk about this. So Bensky, remember we have 3 major texts. I've also brought in like at least another 3 or 4 texts into this. But Bensky is one of the most common, and his team, et al., is one of the more common ones. It was definitely, it's a new version of the book that we used when I was in school, and I think it's very commonly used. And so is the other one, Chen, that we use a lot. So Bensky say the dosage is 9 to 15 grams. Both Chen and Brandon Wiseman. Brandon Wiseman is a little bit newer. Both Bensky and Chen were published in 2004, while Brandon Wiseman was 2008. And the Brandon Wiseman is actually called Concise Chinese Materia Medica, so it's a little bit, it's still a big book, but it has a little bit less on each individual herb than Bensky and Chen. Bensky is a giant book. But anyways, both Chen and Brandon Wiseman say the dose is 10 to 15 grams, so very similar. You know, traditionally things are described in 3-gram sort of increments, and so Bensky tends to do 3-gram increments, but more modern times, the original, because a lot of these are translations from the Chinese Materia Medica books, are going with, you know, are rounding to 5 to 10, you know, using by 5s, and so we see slight differences between the dosing. So this is really close. Bensky 9 to 15, and the others 10 to 15 grams. The category, according to Bensky, is in the herbs that drain dampness. There is no subcategory to this, so it's just the drain dampness, herbs that drain dampness category. Chen say it is in the water regulating and damp resolving herbs category, which is basically a much wordier way and probably more accurate way of saying the same thing. And then Brandon Wiseman, they use Wiseman, if you're not familiar with it, he wrote a book called A Practical Dictionary of Chinese Medicine. If you're on the video, you see me going off to the side looking at my bookshelf here, and where he tries to define technical Chinese medical terms. So his sounds a little bit different to the hearing and to the tongue, but is probably the most technically accurate of these. As Brandon Wiseman say, it is in the water disinhibiting, swelling dispersing medicinals category. So again, same concepts, just different translations and different, you know, slightly different meanings to it, denotations. Bensky and his team say it is sweet, bland, and neutral temperature, and enters the heart, spleen, kidney, and lung channels. Chen and Brandon Wiseman agree, but does not include the lung channel. So they say it's just the heart, spleen, and kidney channels, not the lung channel. Rather than neutral temperature, Brandon Wiseman say it is a balanced temperature, which I like that. You know, I'm so used to hearing, you know, it's cold, it's cool, it's neutral, it's warm, it's hot. But really, neutral doesn't really say anything. I think balanced is a far more accurate term. So I really like that term as opposed to neutral. There is some other information that Bensky had, and I just wanted to bring it up. One of the things we're going to do here is talk about a lot of different types and shapes and things like that. So bear with me as we do this. In this context, he put it under other information. They put it under information. They say 3 different products can be distinguished. The wild product, which is further subdivided into Yunnan Poria or Yunling, as I mentioned earlier, collected from the wild in Yunnan, and white-colored Poria by lIng, collected in Guangxi province, arranged Poria, lIng, a rather flat, heavy, and solid cultivated product, and piecemeal Poria, or lIng, a globular and rather lightweight cultivated product of a loose texture. The main area of cultivation is in Anhui province, and the cultivated product from the region is therefore referred to as lIng. The best quality is Yunnan Poria from Lijiang, Xigu, and other areas of Yunnan province. History, this is a pretty straightforward. It was, the original source for this herb is, both Bensky and Chen Chen say this, is in the Shennong Ben Saojing, the Divine Husbandman's Classic of Materia Medica. That was first written in the 2nd century CE. And if you've listened to this a lot of our herbs are from that. But this is nice. Sorry, I'll explain what just happened in a second. The Divine Husbandman's Classic of Materia Medica is the oldest existing book on individual herbs. So it is a really good. It is the first. So this means it's an old and very established herb in the Chinese Materia Medica. So in the chat box, one of the things when you're learning herbs are a topic, having been in education for a very long period of time, herbs are what really often kill students. It's like they can get the points, and it's very physical, and lots of ways to learn the points, and most people do pretty well with the points. But the herbs, there's just so much information, so many herbs, and so different and so overwhelming that a lot of students struggle with it. So we all come up with our own ways of learning them. For me, it was just drill and kill. I had my note cards, and I would just flip through them constantly as I'm studying them. And often what I'd have is on one side I have a little piece of the herb, because when I was going to school, you had to learn. The tests were practical. You had to look at an herb and know what it was. So I'd have the herb on one side and have all the information on the other side. So I'd look at the herb and I just dictate everything, and I just drilled and killed that. But here we have someone who says in her notes from 1998 at ACTCM, which has been subsumed by another college at this point, but I think it's still called ACTCM. It says, "Learn this herb to the tune of Foolin' by Def Leppard," with a bunch of lyrics about the properties in order to pass the California exam. So there was someone out there who actually did songs for all of these. There was another one who was a graphic artist, and she did zoo herbs and made them all into animals and stuff. There's just so many different ways to learn these herbs. So, and then traditionally in China, they would have songs, traditional Chinese songs or poems. I have a book right here that I often will employ, and I was really shocked that it didn't have Fuling. It's called Chinese Herbal Legends, and it kind of talks about some of the legends of the herbs, and I like that. I'll always bring that in when I can. It has 50 herbs, and they're the more common ones, and I've done it a few times. So. Okay, so that was that. That was the history a little bit in the Shennong Ben Saojing. Let's talk about this category of herbs that drain dampness, because this explains what these herbs do and all that. So according to Bensky again, Bensky has, and his team has really large sections on this and really well researched. So like a lot, not to diminish the other books, because Chen is awesome, but it has different strengths. It tends to go more into the science and the drug herb interactions. And Brandon Wiseman is like the title is concise. It's great. Really good information. I like the terminology, but it's they all have their strengths and weaknesses. Not weaknesses, strengths. They all have their strengths. So according to Bensky, and Thank you, Sarah. She says she enjoyed the herbal legend I included in my dongui video. Yes, that was a good one with dongui. They're all good. So when I can find them, I love putting them in. So okay, so according to Bensky and his team, in traditional Chinese medicine, the term dampness or shi, I first learned Chinese from someone who was Taiwan, and they always put a kind of R sound to the I, and so I often will say shi when it's SHI, and my more Mandarin and mainland teachers have always said shi, so it's shi, but I still sometimes say shi. So shi, the term dampness shi, has two connotations. The first pertains to the accumulation of fluids in the body, which includes edema as well as pathogenic water or shui, and thin mucus yin. These terms refer to an obstruction in the normal metabolism of fluids, primarily but not exclusively of the respiratory and digestive systems. This condition overlaps with some of the disorders caused by phlegm. Indeed, herbs that drain dampness are among those used in the treatment of phlegm disorders. Herbs that drain dampness are especially useful in the treatment of edema below the waist and in the lower extremities. In the treatment of acute edema, they are often combined with herbs that release the exterior, and for chronic edema, with herbs that tonify the qi and yang of the spleen and kidneys. The second meaning of dampness refers to the combination of dampness and heat, or damp heat, and includes those disorders in which there are both signs of heat, fever, burning sensations, dark or yellow secretions, as well as stagnation, which is characteristic of dampness. Disorders in this category include painful urinary dribbling, lIng, damp warmth, shi wen, damp sores, shi chuang, and jaundice, or huang dan. In treating these disorders, herbs that clear heat and dry dampness are combined with those that drain dampness. The main actions of these herbs are to promote water metabolism, or li shui, and leach out dampness, shen shi. This is accomplished by promoting the smooth functioning of the water passageways, which leads to an increase in urine. This is the primary means by which the accumulation of fluids or dampness is relieved. From a biomedical perspective, many of these herbs are essentially diuretics. The herbs in this chapter must be used with caution in patients with yin deficiency or depleted fluids. So that's a good introduction into the category. So what is good quality? Since this is such an important herb, there's a lot on its quality, and we're going to get into that a little bit here. So according to Bensky and his team, good quality is hard, solid, white, without inlays of soil, and sticks to the teeth on chewing. So that's an interesting one that I'm not, when I was learning herbs, again, we had to look at an herb and know what it is. But there's a friend of mine and I in class, and every herb, we had all the herbs. They gave us packets of all the herbs, and so what we do is we look at each other and we pop one in our mouth, a little bit in our mouth. And I don't remember this sticking to our teeth. So either we had poor quality, or it just wasn't something I was looking forward to, or maybe we just didn't have enough of it to do it. It's pretty bland. I mean, that's one of its tastes is bland, so you don't taste much with this herb, which, believe me, was a bit of a vacation from some of the other herbs. So Poria is found in many areas of China, but is grown in Yunnan province. But that grown in Yunnan province is generally considered superior. It is known as Yunfuling or simply Yunling. That grown in Zhejiang, known as Zhefuling, is less expensive, but is also considered to be of good quality. Zhao and Chen. So this is an interesting book. This is a book called The Chinese Medicinal Identification and Illustrated Approach, and it's all about identifying good quality herbs. So it tends to go a little bit more in depth than Bensky does, and they have great pictures, which I wish I could show you on a lot of this. But it's interesting, some of the technical terms they use, like ancient technical terms, like sometimes dragon's teeth on some herb, and it means something specific to that herb. It's really cool. Nothing like that here, but let's get into what they say. So they say whole pieces of Poria Fuling Ge have a demispherical oval or flat oval shape, or may appear as irregular lumps. Whole pieces are externally black-brown or dark brown. They have a heavy and firm texture, which are not easily broken, no odor, and a bland taste. Superior grade medicinal material is heavy and firm, with dark brown outer skin, thin lines on the skin, no cracks, a white and smooth fractured surface, and a strong tendency to stick to the teeth when chewed. So they say the same thing. It's very interesting. Now I want to try some. I have some. I don't know how old it is. I don't know if I want to try, eat it at this point, but I want to feel this sticking to the teeth quality of it. Okay, so that was them on the quality. Let's talk about what it does. What are its Chinese medical actions? So according to Bensky and his team, lIng promotes urination and leaches out dampness for urinary difficulty, diarrhea, or edema due to stagnation of fluids or dampness. Also used in cases of scanty urine due to damp heat. It strengthens the spleen and harmonizes the middle burner. And this is for spleen deficiency compounded by dampness with such symptoms as loss of appetite, diarrhea, and epigastric distension. It strengthens the spleen and harmonizes the middle burner. We talked about the three burners on a previous episode. So this is the middle one, which is generally the one that's very involved in digestion. So strengthens the spleen and harmonizes the middle burner for spleen deficiency compounded by dampness with such symptoms as loss of appetite, diarrhea, and epigastric distension. And it quiets the heart and calms the spirit for palpitations. That's an unusual awareness of your heartbeat. Insomnia or forgetfulness due to either spleen and heart insufficiency or internal obstruction of turbid phlegm. Chen similarly say its functions include promoting urination and resolving dampness, strengthening the spleen, and calming the shen or spirit. So I didn't get into all the these each one of these has a big paragraph of its own explaining it a little bit. So I did that a little bit with Bensky's, but I don't want to minimize that this is also in the other books as well. But they're very similar, so just reading a whole bunch of paragraphs of this, I read enough from these texts. I figured I wouldn't include those, but they have more explanation than this as well. Brown and Wiseman say it disinhibits water and percolates dampness. It fortifies the spleen and quiets the spirit. So they all have this shen quieting spirit sort of thing. Shen is spirit. That's the Chinese word for spirit. And in Chinese medicine, it's a very important aspect of Chinese medicine. So, people need to have a good spirit. We're kind of trained to look in the eyes and see some shen, some spirit. If it's not there, sometimes they're disturbed. Like if you've ever seen someone who's in the middle of a schizophrenic episode, they have very disturbed shen and you can see it. Their eyes are kind of darting. The eyes are kind of the window to the shen. This is a very important concept in Chinese medicine, this shen spirit. Zhao and Chen, while it's not really a book that is about the herbs other than the identification quality aspects of the herbs, it does have a little bit about it. And so they say it promotes urination, leaches out dampness, fortifies the spleen, and calms the heart. So very similar to what everyone else is saying. And interesting, I have a translation of the Shendong Ben Xiao Jing, which is in this case translated as the Divine Farmer's Materia Medica. And they say lIng mainly treats chest and ribside counterflow qi, binding and pain below the heart due to worry, indignation, fright, and fear, cold and heat, vexatious fullness, cough and counterflow, and parched mouth and dried tongue. It disinhibits urination, which means it promotes urination. Protracted taking may quiet the ethereal soul, nourish the spirit, make one free from hunger, and prolong life. So one of the things that is sort of a throughput with the Divine Farmer's Materia Medica, the Shendong Ben Xiao Jing, is that there's a very much a spiritual aspect to it. In Chinese medicine, we have a few souls, the corporeal soul, the ethereal soul. They're associated with different organs, so these are sort of the little bit more spiritual aspects. The shen is, as spirit is one of those. So the shen is involved with the heart. The ethereal soul is with the liver. The corporeal soul is with the lungs. And so all these sort of things are in there. And so there's a lot more discussion, I think, than in modern texts in the Divine Farmers Materia Medica, which I find fascinating. I don't know if I've been able to translate it well into how I treat my patients, but I'm always fascinated with that side of things. And you know, in traditional Chinese medicine, sort of the which is more of a more modern formulation of Chinese medicine, they've tried to get away from a lot of the spiritual aspects of this. And I want to make it clear, because a lot of people say that's post-communism and all that, and it's not. It was happening for a couple hundred years before communism came around. So I don't, this sort of despiritualization, I think, is sort of an extension of engagement with the West and looking at Western medicine, even when it was very good. So interesting stuff. I like go back and look at this history of stuff. So Sarah asks, what is considered ribside counterflow qi? So that's an interesting one. And my interpretation of that is that sort of that ribside area is sort of the area, it's the middle burner again. And it kind of, I think that counterflow qi is trying to describe like liver overacting on spleen. That was my interpretation of that ribside counterflow qi. But as we get into the commentary on this herb, we're going to revisit that, Sarah. So hang in there with that question. Okay, so let's talk about preparations. There's lots of different preparations of this herb. Not so much like often when we talk about preparations, like you're boiling it, we're charring it, we're doing stuff like that. Not a lot of that, a little bit, but not a lot of that with preparation. It's more like how is it cut and how is it, how is it presented to you? So you buy it in these kind of preparations. So according to Dubensky, the source of this substance is a fungus which grows on tree roots, usually those of pine trees. 4 layers of the fungus are used, discussed below. There are many different varieties of the processed herb, distinguished by the method of slicing. Flat and thin slices are ping pian, square poria or fang fu, which is 4 centimeters long and 0.6 centimeters thick. Diced poria or tofu, which are small cubes about 1 centimeter in diameter. Curled, can't say it, I kept wanting to say curried, curled poria or juan fuling, which are very thin slices that are rolled into small cylindrical tubes. That's a common way of seeing this. Poria flesh or lIng roe, which are regular pieces of peeled poria, and crushed poria, sui ling, small slices of a regular shape. The noted early 20th century physician Zhang Shichun observed, if poria fuling is used in decoctions, the squares can be boiled all day, but never boil through. It should be sliced thinly or pounded into powder. Only then can it be decocted completely. Which is interesting because when I was learning all this, it was that thinly sliced curled fuling. That's all I saw. And then suddenly we started getting at the school clinic, we started getting these chunks, hunk of chunks. And if I knew at that point that that's not supposed to be for decoctions, I probably would have spoken up. It was probably, but then again, one of the things that with herbs is we don't always have access to everything we want to have. And a lot of herbology is what else can we use to replace this? In my opinion, I've seen that a lot. So there you go. Okay, let's talk about some other preparations. We have Poria cutis, cutis meaning skin, also known as fuling pi or ling pi, pi meaning skin. So this is the skin of the fuling. This is what it says there. This is the outer layer of the fungal node. It is blackish brown outside, white or grayish brown inside, and soft, loose, and elastic in texture. It is generally considered to be harmonious and neutral in nature, able only to promote urination and reduce edema, but it achieves this without exhausting the qi. It is more diuretic than fuling, but less tonifying. It mobilizes the exterior to reduce subcutaneous edema. This herb was first mentioned in the Grand Materia Medica, or the Ben Sao Gong Mu, written in 1590, where it was said to primarily treat edema and abdominal distension, facilitate the water pathways, and open the pores and interstices. Squares of Poria still attached to the cutis are commonly used. This is called Poria with cutis, or lien p fu ling, or lien p ling. While it still strengthens the spleen, its ability to leach out dampness and facilitate water is enhanced, which makes it especially suitable for water damp edema due to weakness in the transportive function of the spleen. It is often used with Zingiberis rhizomatis cortex, or Shenjiang P. This is the outer skin of ginger, fresh ginger. Mori cortex, sung by P, and Ariacae. I've never been sure how to pronounce this one. Arecae. It's almost a palindrome, but not quite. Ariacae. Pericarpium. Moving on quickly. Da fu pi, as in 5-peel powder or wu pi san. So wu pi san is a great herb. It's for edema, especially of the subcutaneous layers, and it involves all herbs that the skin of herbs. So you can see all these three here and fu ling pi. So that's 4 of the 5-peel powder. I can't remember the 5th one. I want to say ju huang, which is a peel as well. Okay, and the dosage of this particular preparation is 15 to 30 grams, so a heavier dose. Other preparations include white Poria or bifuling and red Poria, chirfuling or chifuling, or Poria rubra. The portion of the fungus that grows closer to the root is white in color and is thus known as white Poria. That closer to the outer skin is pinkish in color and known as red Poria. White Poria is the product that is normally dispensed when just Poria fu ling is prescribed. Penetrating the mysteries of the materia medica are the Bensao Tang Xuan, written in the 17th century, observes that the red variety can only drain heat and mobilize water. It does not have the many actions of white Poria. Red Poria is often prescribed for such disorders as scanty dark urine or urinary difficulty. Another way of looking at this is that white Poria enters the chi aspect and red Poria enters the blood aspect. White Poria more strongly tonifies, while red Poria is more facilitating, in other words, moving. Thus, for enriching the heart and spleen and calming the heart spirit, white Poria is superior, but for limiting water and dampness, especially if associated with blood stasis, red Poria is the better choice. Note, however, that many contemporary textbooks do not differentiate between these two parts of the substance in terms of usage. Another form of Poria is root Poria, or Fu Shen, or Poria sclerotium pararadices. So that's Fu Shen. This is the innermost part of the fungus, around and including the root. It is used primarily for its spirit calming effect. 3 different products can be distinguished. Ge Fu Shen, which is similar in size and shape to Poria with pine roots entering the mycelium. Fu Shen Kuai, which are square pieces of about 5 centimeters in length and 0.6 centimeters thick with inlets of pine roots. And Fu Shen Mu, which is the wood of the pine roots with mycelium of Poria at the outer bark. The best quality is wildcrafted from Yunnan province. The dosage is 6 to 15 grams. And there's a note here that there is an adulterant on the market which is Poria with artificially inserted pine roots. The root and the mycelium are not connected to each other and can easily be separated. There is, I think these are the last 2, dry fried Poria or chow fuling. Briefly dry frying or baking over a low heat enhances its ability to tonify the spleen. And cinnabar Poria or zhu fuling or zhu yi fuling. Squares of fuling are sprayed with water and left covered briefly until soaked through. Then powdered cinnabaris or zhi sha is added and the squares turned until it is evenly distributed over the surface. Then this enhances the ability of fuling to calm the spirit. The zhu sha, the cinnabaris is a calm spirit herb. So this enhances the ability of fuling to calm the spirit while retaining its spleen tonifying and dampness removing effects. Note that because cinnabaris or jirsha is a toxic medicinal, this method of preparation is unsuitable at this time. So we don't do this anymore. Cinnabaris, if you're not familiar with it, is an alloy is how natural mercury is found. So definitely not something we want to be ingesting with what we know now about mercury. Western uses, it appears this herb is primarily a Chinese herb, and it was difficult to find any Western herbal entries for this herb. As mentioned, even though this can be referred to as Indian bread, this is not the same herb the Native Americans use. And the PDR for Herbal Medicines, which is sort of a giant book that I go to for, it's all herbs, but it's primarily Western herbs, does not mention this herb at all. All right, commentary. One of the things I love about Bensky, there's some commentary in Chen Chen, less in Brandon Wiseman, but the commentary in Bensky's is really good. So according to Bensky, here's that commentary. lIng is sweet, bland, and neutral herb. Sweetness tonifies the middle, while blandness leaches out dampness. Thus, on the one hand, it tonifies the heart, spleen, and lungs, while on the other, it facilitates the water pathways, unblocks the orifices, and expels pathogenic heat. Its particular characteristic is harmony in both tonification and in promoting urination, supporting the normal while expelling the pathogenic, and is therefore especially appropriate when the spleen is deficient and there is a simultaneous overabundance of dampness with such symptoms as phlegm and thin mucus, diarrhea, and edema. This harmonious set of functions, which allows the herb to promote urination without injuring the qi, makes it an important choice for promoting urination and leaching out dampness. It can be used whenever there is urinary difficulty, edema, phlegm, or thin mucus, regardless of whether the condition is hot or cold, deficient, or excessive. When the spleen functions harmoniously, both the heart and lungs benefit directly from this source of generative transformation. This is why the herb is often used to treat insomnia and palpitations due to insufficiency of the heart and spleen. Yet its ability to leach out dampness, ease the orifices, and dispel pathogenic heat also makes it useful for accumulation of damp heat in the lower burner, causing painful urinary dribbling with ministerial fire blazing in the kidney channel. Commentary on the Divine Husbandman's classic of Materia Medica, the Shendong Bensao Jing Shi, written in 1625. So this is not the Shendong Bensao Jing that we've been talking about. This is a commentary on that was written 1400 years later. States that its sweetness enables it to tonify the middle, its blandness facilitates the orifices. When the middle is tonified, the heart and spleen are firm. When the orifices are facilitated, pathogenic heat is resolved. Now we get into the Shendong Bensao Jing. The Divine Husbandman's classic of Materia Medica notes that this herb treats rebellious qi in the chest and hypochondria. So this is going back to Sarah's question. Rebellious qi in the chest and hypochondria. Nowadays, this function is usually given short shrift. However, some practitioners, such as the noted physician Zhang Zigong, have found it to be very useful in treating running piglet and similar disorders. Running piglet disorders are a class of disorders that have this sort of feeling of like there's a running piglet around your hypochondrium, so like in the middle there, like maybe just above your stomach or in that area. Very useful in treating running piglet and similar disorders. As these patients also often suffer from insomnia, Zhang used Poria sclerotorum paradiseas or Fu Shen instead of lIng. Interestingly, this was not because he himself regarded it as superior to lIng in this respect, which he did not, but only because it was expected. Interesting. Okay, so not a lot there, but there's some there for you, Sarah. Comparisons. Bensky compares this herb with three others versus Pinellia rhizoma preparatum or Zhiban Sha. This is a very useful herb in treating phlegm. It's considered a transformed phlegm herb. So both herbs expel phlegm dampness, but Pinellia rhizoma preparatum, Zhiban Sha, dries and transforms phlegm, draining the branch manifestation, the visible phlegm, while lIng strengthens the spleen, expels dampness, and transforms phlegm, the root of the problem. Together, both the root and branch are addressed. This is sort of a through theme with Chinese medicine is root treatments versus branch treatments. Versus polyporous or lIng. Polyporous lIng is neutral and enters the kidney and bladder channels. It promotes urination more strongly than lIng, but does not tonify. Essentials of the Materia Medica, or the Ben Sao Bei Yao, written in 1664, says that polyporous lIng mobilizes water and facilitates the lower orifice. The actions are the same as those of lIng, but without tonification. While its effect in promoting urination is relatively mild, lIng also tonifies the spleen, harmonizes the middle, and calms the spirit. These multiple actions explain its wider therapeutic scope in comparison to polyporous lIng. Versus coesis, semen, or yiren. I love this. This is Job's tears, or pearl barley, or a variant of pearl barley. Both herbs are of similar nature, strengthening the spleen and facilitating the removal of dampness. They are often used together in the treatment of spleen deficiency with overabundant dampness or edema. However, coesis semen, yiren, is cold and can clear heat, so that it is often used for abscess of the lung or intestines and lung atrophy. It also removes dampness at the level of the bones, muscles, and sinews. By contrast, lIng is neutral. It augments the heart and spleen and calms the spirit. Combinations. Bensky has 4 combinations with lIng, with alismatis rhizoma zeche. This is frequently used combination to facilitate the removal of water and leach out dampness. The bland flavor of lIng leaches and promotes urination, while its sweetness tonifies the spleen's transportive and transformative functions. Alismatis rhizoma zeche is sweet, bland, and cooling, and excels at driving out water in the 3 burners and the bladder. Together, their ability to eliminate water and dampness is greatly strengthened because the transportive function in the middle burner initiates movement throughout the water pathways, and excessive pathogenic fluids are directed downward and expelled through the bladder. Meanwhile, the spleen chi is protected from the harmful effect of this downward leaching by the sweet, tonifying action of lIng. This combination is appropriate whenever water and dampness become stagnant and gather, leading to disorders such as edema, jaundice, diarrhea, turbid, painful urinary dribbling, and scanty, difficult urination with abdominal distension. The consensus is that this combination is most appropriate for fluid disorders of the middle and lower burners. Another combination is with Cinnamomum ramulus, or guajir. This is cinnamon twig. This combination has a strong ability to drive out water and dampness and is widely used clinically. Water and dampness disorders generally originate from a middle burner disharmony. The sweetness of lIng tonifies the spleen, and its blandness facilitates the removal of water and dampness. Thus, it tonifies, but not harshly, and facilitates, but not violently, gently treating the source of the dampness. Water and dampness are moist, yin pathogens which impede the yang qi. The acrid flavor of Cinnamomum ramulus guajir pierces through and disperses the heavy occluding quality of the yin pathogens, while its sweetness prevents the dispersal from occurring too quickly or from being too short-lived. The sweet warmth of Cinnamomum ramulus guajir assists the expansion of the yang to transform the yin pathogens, breaking up their congealing yin quality. Together with lIng, it can focus its qualities on transforming dampness rather than mobilizing the exterior, while lIng gains greater impetus to unblock the yang, promote urination, and thereby expel the dampness and water. The 2 medicinals are complementary in action and perfectly conform to the ancient adage, disorders of phlegm and thin mucus should be harmonized with warm herbs. Thus, the combination can be used whenever symptoms of water and dampness disorders appear, be it rebellious fullness in the epigastrium, palpitations, dizziness, cough, and rebellious qi, thirst with vomiting of thick saliva, edema, abdominal distension, or urinary difficulty. This combination also augments the qi and calms the heart, calms the penetrating vessel, and directs its rebellious qi downward. It can thus be used when water qi disturbs the heart or when symptoms of running piglet disorder appear. Okay, combinations. We've been talking about combinations. Oh, so I'm sorry, I'm a little confused because we talked about this herb under comparisons, but now we're going to talk about it as a combination. That's with Rhizoma preparatum or Zirban Shah. This is another frequently used combination for treating phlegm, thin mucus, and turbid dampness. Fooling is sweet and bland. Its sweetness tonifies the spleen, while its blandness leaches out dampness and pathogenic water. If dampness is prevented from accumulating, it will not produce phlegm, and the phlegm will not become overburdened. Rhizoma preparatum Zirban Shah is acrid and dispersing. Its warmth dries and transforms dampness. The use of this herb thereby enables the spleen to enjoy a healthy dryness, which likewise prevents the formation of phlegm. Combined, while fooling treats the root of the phlegm by tonifying the spleen and leaching out dampness, Rhizoma preparatum Zirban Shah alleviates the branch manifestation of nausea by directing the qi downward and simultaneously assists the yang-natured transformation of dampness and phlegm through its warm and acrid nature. The use of this pair of herbs has the additional benefit of preventing turbid phlegm and dampness from disturbing the residence of the spirit of the spirit, the heart, which is located just above the stomach. The mild spirit calming action of fooling enhances this effect. This explains the wide range of symptoms addressed by this combination: nausea, vomiting of fluids, hiccup, dizziness, palpitations, insomnia from mental rumination, cough with profuse clear phlegm, and loose watery stools. Again, another herb that we had in comparison is here with a combination, so with Polyporus lIng. When Polyporus lIng and fooling are combined, their ability to leach out dampness and facilitate the removal of pathogenic water is strengthened. This combination can be used for any problem due to an internal stoppage of water and dampness, including edema, scanty urine, diarrhea, loose stools, painful urinary dribbling, vaginal discharge, jaundice, and leg qi, which is edema of the legs, really. At the same time, the spleen strengthening action of fooling assists the recovery of spleen qi, thereby preventing the further formation of dampness. Although the pair is rarely used by itself, if combined with tonifying herbs, it strengthens the spleen. If combined with warming herbs, it warms the spleen. And if combined with cooling herbs, it clears damp heat. Okay, that's it for the commentary. Briefly, the contents, according to Bensky, include triterpenes, including 24-triene, 21-oic acid, polyporanic acid. I think there's supposed to be a comma in there. So polyporanic acid, let's say that, and poriac, I can't even say it, poricoic, there we go, poricoic acid, A, B, C, D, D, M, and AM. I include those because they have the names of the herbs in it, which means that they're probably pretty specific to this herb. There are also polysaccharides, organic acids, and other constituents, including ergosterol, which is a common constituent we see in herbs, choline, adenine, and histidine, which are nutrients that are used, adenine and histidine are used in DNA, RNA, stuff like that. The science. So Chen and Chen say this herb can be diuretic and sedative and have sedative effects in mice and other animals. It has bacteriostatic effects against several bacteria. So that's an interesting one. Bacteriostatic effects mean that it stops the growth of bacteria. It doesn't kill them, but it stops them from growing anymore. So eventually the body will kill them. And that would be, in vitro, which means not necessarily in humans. An extract of one of its constituents, pacamon, may be ananeoplastic as it inhibited cancer cell activity in mice. Again, just because it does something in mice doesn't mean it does something in the humans. So take it with a little bit of a grain of salt. A few clinical studies discussed in Chen and Chen showed positive effects in edema with an N of 30, tumors, positive effect in tumors by decreasing chemotherapy adverse reactions, an N of 70, and in schizophrenia with an N of 53. So interesting stuff, but not as much science as I would expect for such a commonly used herb. Drug-herb interactions. While there are no obvious drug-herb interactions in a scholarly search, fooling has a diuretic effect that may lead to increased elimination of water and/or electrolytes. This is a D-level evidence. This is an expert opinion. I probably happen to agree with this expert opinion to a certain extent, but there's no proof supporting it. The American Herbal Products Association's Botanical Safety Handbook, classifies an herb's potential for interactions, does not. Oh, it actually does have an entry for this herb, and it is actually its safest entry. It is an A-class herb, so no, they don't note any particular interactions of worry. There are some concerns about this herb, however. Bensky and his team say under cautions and contraindications, use with caution those with yin deficiency, sunken spleen qi, or cold from deficiency with spermatorrhea. Spermatorrhea is a very interesting term in Chinese medicine, which really doesn't have an equivalency in Western medicine. I'm at that point where I think spermatorrhea, which basically means, release of sperm, ejaculate. My interpretation of this is kind of rapidly going into nocturnal emission territory, or wet dream territory, because there's no other, sperm just doesn't trip, which is what this implies. So I don't know. So under the heading of traditional contraindications, they say functions to mobilize water and thereby fatigues the kidneys. It should absolutely not be carelessly used when there is urinary dribbling or incontinence due to kidney deficiency or cold from deficiency leading to spermatorrhea, or urinary difficulty due to exhaustion of yin. And this is according to Harmon Benefit in the Materia Medica, or the Lingnan Sao Yao Zhi. And there's an unknown date on this, which I think is interesting. I don't know if I've ever come across a book where we didn't know it was written, at least somewhat. And under toxicity, they say allergic reactions have been reported with such symptoms as generalized pruritus or itchiness, papular rashes, raised rashes, achy extremities, vertigo, and nausea. Contact with the powder drug can cause allergic asthma, symptoms of hay fever, tachypnea, or heavy, fast breathing, and cold sweats. Chen have similar concerns. Use fooling with caution in patients with yin deficiency and or spermatorrhea. And Brown and Wiseman say, warning, fooling is contraindicated for seminal efflux, which is that word spermatorrhea in other texts, and chi vacuity fall. Having said this, the American Herbal Products Association's Botanical Safety Handbook puts this herb in safety class 1, herbs that can be safely consumed when used appropriately. So they didn't have a lot of concerns. They did mention the allergic reaction, though. And that's it. We're a couple minutes early. Over. Not early, over. In summary, we started our podcast today by continuing our discussion of the Chinese medical pulse by adding the slippery and wiry pulses. And then we discussed fooling, one of the most commonly used and useful herbs in Chinese medicine. Definitely a top 10 herb, if not a top 5 herb. Its drain damp function, along with its spleen and heart spirit support functions, are very important. Combined with its neutral temperature, it can be used in a ton of different conditions. And there you go, another fascinating look at some very useful Chinese medicine. In our next episode, we will be looking at another Chinese herbal formula, Ban Sha Sheishin Tang, or Pinellia decoction to drain the epigastrium. This is a really interesting and relatively commonly used formula in one of the most important Chinese formula categories, that of formulas that harmonize. And as usual, we will be exploring this formula in depth and, of course, adding something a little different. Please join us for the next episode. It's going to be fascinating. Thank you very much. If you like this podcast, please do us a huge favor. Subscribe in your favorite podcast app. That really helps us. Thank you for even considering it. And you can get this course as continuing education, get more info on my upcoming integrative nutrition series at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. You can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. And as usual, here is my bibliography. Thank you.
Spurbs Herbs.
The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy Dobbins.
Roger Campbell.